Hi, my name is Gloria Macías Calderón. My topic is Chlamydia Complications. Definition. Chlamydia is a common sexually transmitted disease caused by the bacterium Chlamydia trachomatis. It infected the vagina, cervix, fallopian tubes, anus, urethra, or a serious complication that can occur silently and cause irreversible damage such as infertility, sterility, or ectopic pregnancies.
Chlamydia is the most common sexually transmitted infection in the world. Sexually transmitted infection. And you might recall from our conversation about gonorrhea, chlamydia often co-infects with gonorrhea, or they tend to occur together. Now, there are several species of chlamydia that exist, but when we talk about the most common STI that's responsible for the disease chlamydia, we're talking about chlamydia trachomatis. Trachomatis. And the way it gets this name, trachoma, is the term for the eye infection that occurs with chlamydia, as we'll talk about in a minute. Now, with any sexually transmitted infection, we have to consider the mechanism by which the infection spreads from one person to another. And that process is called transmission. And there are several ways that chlamydia is transmitted from one person to another. Sex is the most common way, and that can include oral sex, vaginal sex, and anal sex. Childbirth is another important mechanism for transmission, as we'll talk about in a few minutes. And finally, one of the unique ways that we can transmit chlamydia that we can't with many other sexually transmitted infections is with direct contact. Now, I want to throw a big asterisk over here, because chlamydia can only live outside of a human host for about a few seconds to a minute. So direct contact means something like scratching an infected organ of the body, say part of the genitalia, and then directly touching another part of the body like the eye. This doesn't count for one person touching another person directly and spreading the infection. That's very rare and unlikely to occur. Direct contact means to spread from a person to another part of that same person's body. And we'll talk about that in the case of conjunctivitis or an eye infection of chlamydia. So now let's move this list off to the side and focus.
Application in nursing. Explain to the patient what the disease consists of. Avoid sexual intercourse during treatment. Use a condom and do not have many sexual partners. Indicate that underwear and bedding must be washed separately. Laboratory tests will be performed: culture, vaginal exudate, and the management of antibiotic azithromycin, doxycycline.
Fall off. So a lot of patients ask me how often should they get tested? And to be perfectly honest with you, there's no one answer because everybody leads a different type of sex life. General advice we would give, if you're a guy who has sex with guys and you have frequent partners, we would advise you to get tested every 3 months. If you're straight or gay, and another time to get tested would be if you're entering a new relationship or you're leaving a relationship. That's often a good time to get tested as well. Some people also like to get tested, of course, if they have symptoms, and also some people like to get tested, for example, if they're considering having a baby or for another life event, for example, buying a house. There's lots of other reasons. But general advice would be one rule doesn't fit all. But for people who are having a lot of sexual partners, we recommend every 3 months. Or if you're entering or leaving a relationship, they'd be kind of the general rules or guidelines for how often to test. The complications of chlamydia are obviously more serious for women.
Pros and cons. Chlamydia bacteria can be treated early through laboratory tests and the use of antibiotics. But in other cases, chlamydia, it can cause permanent complications such as infertility or pregnancy damage.
Hi there, my name is Dr. Dominic Rowley and I'm the Medical Director of Let's Get, which we'll discuss later in this video. Is chlamydia treatable? Chlamydia is really treatable. It's quite a simple treatment. In most cases, it's a once-off antibiotic dose. So you swallow 4 tablets. Well, depending on what country you live in, you swallow either 2 tablets on a once-off dose on an empty stomach, or you swallow 4 tablets as a once-off dose. So that's the most common treatment. Occasionally, if things are a little bit more complicated, if women have pelvic pain, for example, or if you've chlamydia in your anus or your bum, or if you've chlamydia in your throat, you may require a week-long course of antibiotics. But overall, it's very, very treatable. If you have chlamydia in certain places, for example, the anal area or the throat, or if women have a coil in place, you may need what we call a test of cure. So 2 to 3 weeks after you finish treatment, you retest to make sure the bug is gone. But in most cases, you don't need to do that. Chlamydia is diagnosed.
Issue applied in Ecuador. The Ministry of Public Health of Ecuador and indicate national program for prevention. It is necessary of implement screening of chlamydia trachomatis infection, especially in growth irrigated growth to avoid complication.
Welcome back, friends. In this whole series of videos, we'll be talking about chlamydia and the infections caused by chlamydia. And there are 3 major species of chlamydia that we are going to talk about. And one of the major, all of them, is chlamydia trachomatis, and we'll be talking about in details about this chlamydia trachomatis infections. Okay. So let's begin with it. And this whole course will be talking about 4 different sectors. First is the properties of chlamydia, general properties. Second, we'll be talking about the pathogenesis of chlamydia. Third is the clinical manifestations and the disease that are caused by chlamydia. And the fourth one is the treatment and prevention. So let's begin with the first phase, which is termed as properties of chlamydia. So let's begin. Now, in very first case, I must tell you why we are studying chlamydia, because chlamydia is a very dangerous kind of what you can say intracellular parasite that can cause severe kind of infections in both male as well as female. It can also cause infection in infant and children too, right? Now, if you can see in this graph, it is depicting as the rate of chlamydia infection by sex in male and female, both the cases. You can see in males the infection is pretty much low, but in women the infection is pretty going very, very high. So you can see the rate means here per 1 lakh population how many people is infected. So you can see this infection is taking a toll. It is going out and out throughout this time, and it is going up in this direction. So we need to control it, otherwise it will be very, very dangerous, right? Now it is estimated about 3 million cases in US annually. So you can see how much dangerous it is, right? And obviously most frequently reported STD in US. So it is being associated with the most frequently reported STD. Both this chlamydia as well as there are spirochetes, all of them, they are among these STD infections mostly reported, right?
Conclusion. There are asymptomatic cases of patients with chlamydia. It is necessary to perform the test. If chlamydia is not treated in time, it has very serious consequences. In women, it can cause infertility, and the men damage the urethra. The use of condom and hygiene is essential.
When symptoms do occur, lower genital tract infection can manifest as upper genital tract. In men, chlamydia can cause epididymitis, which is not thought to be an important cause of long-term sequelae. In women, upper tract infection can lead to pelvic inflammatory disease, or PID. PID involves infection and inflammation of the uterus, fallopian tubes, ovaries, and adjacent tissue. Clinical diagnosis is imprecise. CDC recommends empiric treatment for PID when young women have lower abdominal pain with no other clear cause and either uterine or adnexal or cervical motion tenderness. PID has multiple infectious etiologies, including Chlamydia trachomatis, and the symptoms of PID can be very mild, and subclinical tubal infection and inflammation are known to occur. Chlamydia-associated tubal inflammation can result in fibrosis, scarring, and loss of tubal function, which in turn can lead to long-term sequelae, such as tubal factor infertility, ectopic pregnancy, and chronic pelvic pain. Tubal factor infertility is the inability to conceive due to structural or functional fallopian tube damage. Chlamydia is the leading preventable cause of tubal factor infertility.